and you look in one little tiny drop of blood, there is literally thousands of these little worms crawling. And if you just think, every drop of blood in this dog's body has that many worms crawling through it. It's just incredible. This week I wanted to talk a little bit about heartworms, since heartworms can be transmitted all year round, but summertime is a big time for heartworms because heartworms are transmitted by mosquitoes. This is something that I think this is one of the underappreciated parasites of the world, because it's a deadly thing. These heartworms live inside the dog's heart, or in a cat's heart as well, and they can be very serious. But we see fleas and ticks a lot, and we don't want them crawling on us, and we get all creeped out about it, and we obsess about fleas and ticks, and we don't really think about heartworms as much as we should. So take a look at this life cycle of the heartworm. Over here, it takes about 6 months for the heartworm to go through its life cycle. So we're talking about the worm now itself, how it lives, and it works with multiple dogs to make its life cycle. So this dog has heartworms, and the mosquito comes and lands on him and bites him and takes a blood meal. And in the blood are the circulating microfilaria, the small baby heartworms that are circulating in the blood. And that's actually one of the things that we can test for. We take a drop of blood and look under the microscope, and we can see these little worms swimming in the blood. It's really quite amazing. If you ever see a dog that's positive for heartworms, and you look in one little tiny drop of blood, there is literally thousands of these little worms crawling. And if you just think, every drop of blood in this dog's body has that many worms crawling through it. It's just incredible. But anyhow, the mosquito takes a blood meal, and it actually flies around for several days, and that worm transforms inside the mosquito, and it goes through several larval stages. It's tiny little baby microfilaria, and it grows up into several larval stages to become an adult worm. And actually, it's not infective to the dog until it reaches a certain stage, and these stages have really catchy names like L1, L2, L3, L4, these larval stages. So this becomes important later when we talk about preventatives. But anyhow, this mosquito bites another dog and deposits those worms into the bloodstream, those tiny little infective worms, and those heartworms will tunnel outside the blood vessel and stay in the tissues for a little while, and then they will go back into the bloodstream and travel to the heart, and they will grow into be a big long worm inside the heart. So here's a bigger picture you can see. This is the pulmonary arteries inside the lungs. So a lot of people say maybe you should call this a lungworm, because they really like to live up here in the pulmonary arteries, and then they fill up the ventricle as well. But you'll find a lot of worms up in this artery. And they actually will clog the arteries. They'll bang around in there and cause an allergic reaction on the inside of the arterial wall, and it can cause a tremendous problem where the heart dilates and you go into heart failure, and they have coughing and wheezing, and they can have different problems like that. So it's a deadly disease, and actually the cost and the trouble to treat it is very difficult, because once this worm is inside, see, it was tiny, it was microscopic when it first came in the dog's body, but once it developed inside the heart, it grew into a full-size worm. So when you go and treat this and kill this worm, it goes in through the pulmonary arteries and goes into the lungs, into the tiny blood vessels of the lungs, and it just gets stuck somewhere in the tiny, you get this big long dead heartworm inside the lungs, and you have this embolism and a blood clot that forms, and the body walls it off, and the white blood cells come in and try to clean up that problem. So you can have an event or a problem of coughing and wheezing, a spell that comes from treatment of the worm. So the treatment can be just as serious as the disease sometimes. So prevention is key. Every dog should be on a heartworm preventative all year round in Virginia, because the mosquitoes come out in the wintertime, we get a warm spell, and they can transmit heartworms. And some people say, I've never seen a dog with heartworms, I never have heartworms, and some people see it over and over again, so they have multiple dogs die from heartworms. And I think it's because that partly it's luck, good luck or bad luck, but partly because there's two dogs in this life cycle. So if you live in a neighborhood where a lot of people have dogs running loose and they don't treat them for heartworms, these dogs have heartworms and more mosquitoes have a chance to land on these dogs, and they have more chance to spread it to your dog. So everybody's exposed to mosquitoes outside every time you go to the park, but if your dog lives in a neighborhood where there's not very many dogs around, there may not be as many heartworms in your particular neighborhood. But it's hard to predict that. And maybe I'm getting a little off track, but we should always prevent heartworms. Treat with a heartworm preventative. So that brings me to what is the best heartworm preventative. And for years, the first one that came out, well, it's not the first one. I wonder if anybody remembers Filaribits. We used to have Filaribits. You had like a little big, round, brown, chewable medication that they would take every day. Your dog had to take one every day to prevent heartworms. And some dogs love the Filaribits, and people would say, you know, I have to have those Filaribits. My dog loves them. I got to give them something every day. And other people would say their dog would not eat it. When you have this thing that's this big around and your dog won't eat it, it's hard to get them to take it every day. And so we had a lot of problems with heartworms because people just wouldn't give the medication. And back in the day, I remember in 1986 when I was in high school, I had to work at the animal clinic, and one of my things was sorting all the Filaribits, keeping the shelves stocked with those Filaribits. So comment below if you remember Filaribits, if you're old enough. Please make me feel better that I'm not the only one that's old enough to remember Filaribits. But anyhow, this HeartGuard came out, and that was a miracle. Compared to having to give Filaribits every day, this HeartGuard you do once a month, and it's a chewable flavored treat. And they did a lot of testing on this, or they got very lucky that this chew is actually one of the most flavorful chews that I've found. That not every dog loves it, but many, 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 many dogs love it. And then people are very happy with that product. And so when it came out, it was amazing. And it was the first one that was once a month, and it was great. This Interceptor is another product, and it comes out, and it's once a month, and it is called milbemycin. So this is ivermectin, this is milbemycin. And what happens with these drug companies is they get a trademark on a certain chemical or medication, and then they are allowed to use that thing, and they're going to keep control of it as long as they can because they're trying to make money. But I think veterinarians really like milbemycin better because it treats roundworms, hookworms, and whipworms as well as the heartworms, where the HeartGuard only treats roundworms and hookworms, and I'm not so sure it does the hookworms as well as I'd like it to. But it treats both of these products. You're doing once a month. You're not only treating for heartworms, but you're treating for intestinal parasites, which can be very serious for your dog, and also it can be transmitted to people. So you're protecting your family by being on this. So that's a great thing to have them both on that. Then what happened was these drug companies started losing the control of the patent, and some of these other products were coming out. This is milbemycin with trifexis, is called, with spinosad for fleas, and it also is milbemycin. So it's another product that has the milbemycin in it. It's perfectly effective. All these are equally effective for heartworms. And this is another company came out with milbemycin, and they add lufenuron, which is a insect growth regulator that helps with fleas. So they say everybody's trying to come out with something that's, hey, mine's a little extra. It does a little bit for fleas, and it also does heartworms. So they try to outdo each other. But really, neither of those have total control of fleas, and they don't have ticks either. So I don't know if that's worth your money. So this latest thing is just this year, the first company, Seva, came out with this Milbegard. And it is a generic form of milbemycin. So it is basically the same as the Interceptor tablet. It's just a bioequivalent to Interceptor, except it's generic. So that's the great thing about this is equally safe, equally effective, and it's cheaper in price. So that's something that we're starting to carry now because we're always looking out for people to find out what's the best product around. On the other side, for quite some time, there have been generics of HeartGuard. And this one is called TriHeart Plus. So it's a generic. It is bioequivalent. It's the same ivermectin that's in the HeartGuard. It's equally effective. It should be just fine. This is one called Iverheart Plus. And both those products should work just as fine as the HeartGuard. The problem is they come in a flavored tablet. It's really huge, especially for the large size dog, and a lot of dogs don't like it. And what I've found is if you have a little chewable treat and your dog loves it, it's great. And if he eats it right away, then that's great. If he has a flavored tablet and he eats it right away, that's great. If he won't eat it, people will cut it up. They'll try to put it in peanut butter. They'll try to do all these different things and then end up losing some of the medication in the process. The dog's not getting it every month. He has to get it every month, so it has to be easy and it has to be effective for it to work. So that's why I like this Milbagard also, because it's a smaller tablet and it's flavored so that they will eat it and they will enjoy it, and hopefully it'll go down real quick. If not, you can smear a little peanut butter on it, and it's small enough that you can make sure it goes down. And you don't have this great big thing you got to chop it up and try and hide it as things. So we have milbemycin, we have ivermectin. One other product here is called selamectin, that you can sounds like ivermectin has similar, it's kind of a cousin to that. This is Revolution, and it's the drops that you put on the back of their neck, and it actually it treats for heartworms, so as well as fleas and ticks, and but it doesn't treat all the ticks. But it's great for heartworms, and it's in a drop on the back of their neck. Some people can't give their dog anything by mouth. You just can't get it down them. So this is another option. You put drops on the back of their neck. Here's, all these companies are trying to compete with each other. We have Advantage Multi, which is Advantage for fleas, but it also has moxidectin for heartworms added to it. So those are drops. So instead of the selamectin, it has moxidectin. And then the Bayer company that makes this product also has the moxidectin by itself. There's the topical drops just for heartworms. So there's a couple different things out there on the market, and it's best to give us a call if you have any questions about this, and we can find out what's best for your pets. So one thing that a lot of people don't know about is heartworms in cats. Heartworm is a deadly disease of cats because it is made to be in the dog. This HeartGuard company makes the same ivermectin tablet for cats, and it's a great product. Every cat should take this once a month, and I had a very hard time getting people to do it. They just don't want to give their cat a pill every month, and the cat doesn't want to take the pill every month, and they just give up, and they're like, I'm not doing it. And so this same company, the HeartGuard company, came out with a new CentraGuard, which is drops. This is actually iprinomectin, which is similar to the ivermectin, but it's a different product technically. So that's once a month drops for cats. But I think the best one, if you're only going to get your cat out and treat him once a month, if you can treat fleas and ticks and heartworms all in one product, that's going to be the easiest, it's going to be best. And actually, these all-in-one products end up being cheaper in the long run because you're treating fleas and ticks and heartworms. You're not going out and buying a heartworm pill and then buying a flea and tick treatment as well. So I like this one best for cats. This is Revolution Plus, and that's just that's my personal endorsement because I think it's the best product on the market. It's not because I have any kind of relationship with these companies. It's just a lot of things change. A good example of that is this Milbagard we just started with now. It's a new product. It came out. Both these are new products, and I think they're better than what we had before. So that's why I recommend those. So for dogs, for heartworms, I like the Milbagard. For cats, I like the Revolution Plus. That keeps it pretty simple, and 90% of the time, that's going to be solving your problem. This Milbagard, I believe it's a beef flavoring, but it's actually grown in yeast cultures, and so it's a flavor tablet, but it doesn't have any actual beef proteins in it. So if your dog has allergies to beef, then you can still have that. We keep this on the shelf too because personally I don't think it's quite as good as this one, but dogs love it. And if your dog loves it and you're in the habit, and you know how it is, I have my little dog at home. If she gets her little treat and she thinks this is a treat, even though actually it's medicine, she's got to have it. You know, she wants it. So those are the best products I think for heartworms once a month. Do you have any comments? So that's a quick overview of heartworms. It's that time of year. if you give us a call, the Milbegard, I think all of these products have some rebates going on right now, and it's time for the sun to come out and the heartworms to start breeding. So give us a call about that. And if you like what you see here, give us a comment below, give us a shout out, share it with your friends. You know, if you have any questions or ideas for future shows, let us know in the comments below.